All right, let's get to the details of those stories now. Now, the panic mode is still on as health officials continue to search for the source of strange disease that has killed 4 students, actually 8 this month at the Kumasi Academy, 5 days after the first death. At least 18 other students have been hospitalized since and everyone connected is worried. This afternoon, as officials search for solutions, teachers, students and others connected to the story have turned to prayers in keeping hopes alive. Well, let's say it's purely a matter of faith. So this afternoon, the search for solution is on with the WHO monitoring events closely. Tests being undertaken by the Noguchi Center for Medical Research may just establish the cause to help identify the solution from there. Senior pathologist Dr. Osei Sampini of the Komfanochi Teaching Hospital say they are unable to name the disease based on the signs they've seen so far. He also says that all the bodies exhibited same signs and believes it might be one of its kind in Ghana. He spoke on Inshura FM.
2 separate incidents. First one is in July. And no July, I did all the Dynamic Academy see all the children jabbing. But no, we are
for the July incident, I traced all the bodies to take samples. I found out they died of a special type of meningitis caused by a bacterium, Neisseria meningitidis. When I finished with the recent one, I told them it's not usual. All the children followed similar fashion. Their skin had special characteristics, and they all had blood under their eyelids, pointing to a viral infection. It's now sporadic, so it's difficult to detect for now. The symptoms they exhibited earlier are similar to meningitis and malaria. After the findings, I won't be surprised to be something strange in Ghana.
But the fact is that if it is carried outside of Ghana, I will not be surprised. It might be something that is so strange because you will be that. You are the first active organ how you first to discover. You are in terms of you're contagious, highly contagious.
It's highly contagious. The students should have remained in the school. I've exposed myself to the disease. If I'm gone, I've contributed to someone's survival.
Maybe if I'm gone, at least I have been able to contribute for someone's survival.
Dr. Osei Sampene there. Let's go live now to Kumasi and get the latest from Parliamentary and Kwesi Deborah. Parliamentary has been at the school, so we deal with the school angle, and then we go to Kwesi Deborah, who has been at the hospital. Ohiming, bring us up to speed on events at KUMACA today.
There was yet another busy day for Kumasi Academy school because the regional minister and then the deputy education minister and his entourage were in the school to ascertain the information for the first time just from the ground. So the minister held a closed-door meeting with school authorities after meeting the regional minister and then health officials in Kumasi, and also addressed the first student effect. And he said, yeah, he sympathize with people, families and parents who have lost their loved ones, especially students who were studying at Kumasi Academy. And he extended his condolences to the family and ensured that, yes, as education officials, their duty is to protect children who are in their care and also nurture them and also them to complete their education in these.
Let me find out from you what school authorities are doing, because one of the most important things they ought to do at this point is to manage panic. So they ensure that there isn't panic, because then when panic sets in, then people behave irrationally. Are they putting in place any measures to, prevent panic among the students and, of course, their parents?
Not to that extent. For as much as I know, even in the school, when we went there, for instance, parents who went there this particular morning, some had agitated to withdraw their words from the school. Those even at the entrance, for instance, the security officers at the gate had to engage in this exchange of words with the parents, because the parents thought that when they came there in the morning, the school gate should have been open for them, but the security, subjected them to series of questions, and that actually infuriated them. Some of them left the scene angrily. I remember the Kumasi Technical University acting registrar who we spoke to in the morning. He left very, very angry because he couldn't, withstand some kind. He said words that were
the exchange of words. Now, let me also find out from you. Yesterday, in the videos that we saw some of the students running out of the school. So they're basically going outside. Now, what we know at this point is that they can't really understand what kind of bacteria or what kind of infection we're dealing with here. But the students seem to be going outside of the school. Parents have come inside of the school. If there's any contamination, it's obviously spreading. Are they looking at this?
Unfortunately, the students were not running out of school. They were rather running out of the school's assembly hall after reports of a colleague collapsing reached the assembly hall, where parents and teachers were meeting the regional minister and the regional health officials and the world health officials. So they were not running per se.
Some of them, I think those who took the one who was who had collapsed to hospital did get out of the building. That is something that the authorities should be looking at. Are they?
You see, the incident, the problem with this particular issue is that the information flow, apart from the intervention of the regional minister and that of the regional health officials, and the regional education authority is also doing its best to help in the dissemination of information. Other than that, even before I broke this story last Friday, I made several attempts to speak to school authorities, but they wouldn't respond to the issues. So the school itself haven't seen that particular effort, and that's the same way some parents are not also happy with the way the school authorities have managed information as far as this issue is concerned. So I haven't seen the school authorities trying to maybe some sort of do something to manage the panic in this instance, apart from when the parents besieged the school yesterday, they called in police, and the police had to assist in that particular. So for now, it's been an issue for the Regional Coordinating Council and the Education Office, and then the Regional Health Directory. So it's no more an issue from the school again. Even when you go and you want to speak to school authorities, the Air Force, all your Air Force, they'll tell you the headmaster and his assistants are not on campus. So these are some of the difficulties in speaking to school authorities. So it's difficult to say that this is exactly what school authorities are doing, but I can pinpoint what the Regional Health Directorate and then the Regional Coordinating Council is doing. For now, they are saying that if you want information, speak to the Regional Health Directory. So it's now a health issue more than an education issue.
Okay, and if they're making it more of a health issue and allowing the Health Directorate to deal with it, is the Health Directorate giving any information as to how they're managing and preventing panic, and how they're managing those who are going in and out of the school?
Now, the health officials are asking the media to help in this order. The officials are asking the media to support the cause of managing this issue by putting out correct and the right information in the media, so that whoever listens, especially the parents, will not panic. They'll be able to manage this anxiety from the parents as well.
Right.
So they are counting on the media to be able to reach out to the other members of the community.
Okay. Ohemi, finally, today we saw the students and some of the teachers, I suppose, and some other men of God who had joined them, praying with them. Give us a little bit of a background as to spirituality when it comes to, Kumasi as a whole, when it comes to the Ashanti region, and how it went down in the school. We've seen some, but of course there are things that not everything. The camera isn't able to carry everything all the time.
That is true. Religion has been part of the Ashanti region. It's so integral. It forms an integral part of our daily activities here. And in the school, Kumasi Academy, for instance, I'm told every Wednesday and Fridays they go for worship. So today, when we went to the school, they were already at the assembly hall for worship activities. So during these worships, they spend time to pray for the school, so that, in fact, to call for spiritual and divine intervention to be able to unravel this particular problem that has already, a challenge that is being faced by this particular school. And in as much as they were doing this, some students were also at a point that they have designated taking this antibiotic drugs. And I have a copy. Some journalists like myself, we all went for a copy of this particular drug, so that we will also to protect ourselves. Because when we spoke to health officials, they said that if you spend time at the school, you also need to protect yourself. So we all went for the antibiotics. Okay,
so hold on for me, Ohemi. Let me engage Deborah, who has been following up the situation at the hospital. Deborah, what are the doctors saying beyond the inability to establish what the bacteria or what the virus is after autopsy?
Well, Gibbs, we've been trying to get in touch with the doctors there, particularly the medical administrator who spoke to us earlier about the number of people who have been admitted and also those who have been released. But unfortunately, he's been tight-lipped on the matter today. We're trying our best, but he's been absolutely tight-lipped on the matter. Gibbs.
And what's the situation at the hospital? What are the protocols? Have you been able to witness any of the protocols when these students or when students from KUMACA get to the hospital? Is it a normal day, normal activities?
Okay, I've been speaking with some of the parents I see, and I saw two parents today, and one earlier came for a test, and he's coming again for another test. And that parent I spoke with is particularly confused because his son was initially diagnosed with malaria. And he's been told that the symptoms of malaria are quite similar to meningitis. And that's why he is worried. And this quite based on, there was this interview with Dr. Sampany at the morning that the bacterial infection might not be a bacterial infection after all. It might be a virus infection based on the initial autopsy report.
Okay.
And the person who I spoke with earlier, they've been advised to go to the Kumasi Teaching Hospital because they have the necessary equipment or the necessary to deal with such an infection. So it's a bit of, they are afraid and they don't know what we do.
Let's wrap up this conversation. Ohiming, from the Health Directorate's perspective, are they saying anything about the way forward from here?
This is now they will be establishing or adhering the protocols for the management of this particular condition. So now, health officials, even about 40 students who have been affected, and some who are still on admission, are responding to treatment. So they say that there's no cause for alarm. For them, they will continue to monitor developments, continue with their surveillance programs to ensure that they unravel the circumstances or they are able to diagnose this particular condition. So they are not resting, they are not sleeping. They say that whoever thinks that they have been sleeping on the job, that person should revise his note. And the regional director says, as far as he is concerned, they have been doing their best to manage the situation.
Very well. Ohiming, thank you very much for that update. Deborah, from the hospital, do you get the sense that things are under control?
Yeah, for what they told me, that's not official. The 18 who are on admission are in a stable condition. And so that's what we're monitoring. I'm trying to get to them and ask them how they are feeling. But that's what we do. They are quite in a stable condition. And those also coming there are being referred to a Kumasi Teaching Hospital. When they look at you and they think the symptoms are far beyond, then they send you, they refer you to the Kumasi Teaching Hospital.
Deborah, thank you very much for that update. Humanitarian and Kwesi Deborah there in Kumasi, bringing us up to speed. One from the hospital, one from the school. It's obviously a very worrying situation. We'll be getting some more information on that and giving you information as to how you can keep yourself safe as well. But meanwhile, some angry parents of the student removing their children from the school.
I have monitored development here over the last term, when this particular thing broke out and some students died. You see, the problem I have with these authorities is the intransparent nature of the way they are handling the things. You see, if there's an epidemic or disease or whatever, it is not your fault. You have to tell us. You can't tell me that a student population of about 2,000, all the parents are truck pullers. All the parents, they know something. We can meet and then we share ideas about how to solve the problem. But you come here, even the regiments come there and they shove things and this one will go. Why is it that since that time they even promised that they will set up a small unit here and monitor the disease and the causes? Has that thing come?
Yeah, who made all these promises?
No, I heard it. They told some association of the parents that there will be a small unit here to monitor that kind of diseases. What I'm saying that they are not treating this kind of thing with transparency. Otherwise, why do they a PTA meeting and we come and sit here, nobody tells anything, and we go away?
So, in your own estimation, when you say they are not being transparent, what exactly do you mean?
They are not telling us the truth about the causes of the thing and how they are going about it. We only come here.
So why are you accompanying her to school this morning? Is that what you do every day?
I came for her. When I came, they said that they have given them some antibiotics or whatever. I even interviewed some girls. One of the girls said that she didn't take the medicine because they said that when you take the thing, you have to come today also to take and come on Thursday. And the Thursday they will break for some time or whatever. That was what the student girls told me.
Okay.
But my girl, when I saw, she said she has already taken it. I said, okay. It's okay to take it. So it means that today too, you have to come and take it and Thursday. That is why I've come here with her. So I wanted to go inside and go and verify myself what they are doing before I go to my office.
So beyond you following her, doesn't mean tomorrow you follow her and then the following day you follow her.
So I mean today when she takes the medicine, I will come to take her away.
Are you changing her school or something?
Oh, I'm planning. Already I've discussed with some people at a certain St. Andrews, a private school in Asimfosu. So that is where I'm planning to take her to. because these people are not being transparent. The way we are handling them is like a kid's gloves. The same disease broke out, it fizzled out, it has resurfaced again, even with deadly consequences. I learned about 5 people who have died.
It's only 4.
4, sorry. But at least whether 4 or 1, there's death. You know, and these are not too much natural death that somebody was so. I mean, people die in every secondary school. Every secondary school, people die. In our polytechnic, people die and so on. But why are parents hurrying up here and there and so on? There is something here. You see that what my beef is that since that time they haven't told us anything about this. Look as if we have all forgotten and we have all gone to sleep. I am a school administrator myself. As I stand here, I'm a tertiary school administrator, and that is not the way we go about things down there.
As a parent and as a school administrator, what do you think will be the best way for the school authorities of Kumasi Academy to solve this problem?
The best way is that first they have to call a very transparent meeting of parents. It's an urgency one, and tell us what has come, so that when we come, we will all digress and deliberate on the issue. Whether the medical health services or whatever, if we know even some expert outside, we can on our own accord bring the person inside to come and help. You see, they say it's not a meningitis, it's not this or that, but still people are dying. I mean, this is not this knee-jerk approaches. I as an ACE administrator of a tertiary institution, I don't support. I don't. You know, it is not too transparent. That is the point. It is not transparent. Me, when I get the chance, I'm taking the daughter away. I mean, you can't. As I gave the history. My 3 children have been here,
okay,
and they pass well, and they are in very good institutions, good courses. You know, otherwise, why? But human health is very, very important.
Obviously, he is outraged, and you will understand how he feels. Joseph Opoku-Gakpo, by the way, has been in Parliament, where the Minister of Health was also there. He seems to have some answers. Let's see how it went down, whether or not it pleases all of us and calms our nerves and removes the panic. Joseph, you're welcome.
Thank you very much.
Now, we understand that the Minister was in the House today speaking about what public health interventions are in place to deal with this. Tell us about it.
He was summoned because Muntaka Mubarak raised the issue yesterday.
Right.
And, he was expected to come on Friday, but he showed up today to come respond to questions. He said following the outbreak, they are taking a number of public health actions. Let me run you through them quickly.
Please.
He says they are taking the specimen when it comes to those who've died and those who've been affected by this from you know, the various individuals to the KNUST Hospital and also the Noguchi Memorial Institute for Research for investigation. He says they are intensifying surveillance throughout the municipality, even beyond the Kumasi Academy campus itself. So their personnel are out there. They are reviewing the records of all those who showed up at the sick bay with various symptoms or all sort of diseases, because they want to be sure that those students who came and reported other forms of illnesses are still fine. They are also referring a number of cases to the KNUST Hospital. At first, when students show up with symptoms of the disease, they were being treated at the sick bay, which was handling up to 60 cases a week. But as part of the measures, all such cases are being referred to the KNUST Hospital because they think it's a larger place, it has the necessary equipment, it has more adequate personnel. They are doing follow-ups on those who've been taken to the KNUST Hospital. They are developing a list of those who've come into contact with those who have died or have been affected by the disease, just so they will do the follow-up and be sure they are safe. He said that there was an emergency meeting held between the health authorities and the school authorities. A team from the national level has been deployed to the region and also to the Asokoro-Mampong area to support the response, and he outlined 6 specific things that they are doing as well in connection with that. I was just about going there. Yes, there is technical and logistical support which is being given to the region and the municipality. They are establishing an epidemic center on the campus of the Kumasi Academy school itself. They are working to stop further transmission. They are establishing, it's happening today? It's actually been set up, he says, except that they need a lot more personnel there. They are educating the school population about the disease. They are trying as much as possible to prevent further spread to the community, and they are putting together a more comprehensive report on what has happened to get out there to the authorities, even at the higher chain. And so, looking at this, what's the way forward? What are parents to expect? What do we do? He said that on the 4th of November, There was a meeting between school authorities and students and the health team that's helping deal with the situation. A post-mortem is being done on those who have died, just to get to the bottom of this. There was a briefing by the Ministry of Health and the Ghana Health Service, which targeted the students and some members of the community. They are sustaining surveillance for early detection of additional cases. They are enhancing case management by the deployment of a medical officer to the school clinic during the investigation period. He said that at the school itself, there isn't a medical officer, a doctor there permanently, but for the next 30 days, they are sending in a doctor there permanently to help supervise the situation with regards to the children. They are doing all the necessary laboratory confirmations. They are doing what they call daily updates when it comes to this situation, making the point that they hope to increase communication between the various stakeholders and even communication to ordinary members of the public going forward, so everyone knows what they are doing to help.
So obviously there aren't any plans there, unless of course there isn't, we don't know, any plans to either move the students from the campus or keep them there?
That it's not something that he was quite definite on, except that he made the point that for now they don't intend closing down the school. For now, what they are doing is they are keeping them there. They are administering the antibiotics for them to have access to. They are increasing monitoring, just because they don't know what exactly is causing the disease. They don't want to send them out into the community. But that's where other MPs have concerns.
Exactly.
The fact that
because their parents are also walking in and out. Reporters are walking in and out. Security personnel are walking in and out. So there's obviously a problem there. So
for example, the deputy ranking member on the health committee in Parliament, Dr. Robert Kunleb, he makes the point that he thinks that at this juncture, what should be done is for them to evacuate the students from the campus, get the campus fumigated, especially when they've not gotten to the bottom of what is causing it. He thinks that the source of the infection could be the students themselves, it could be a particular spot on campus. So he doesn't understand why the students are still being kept there. And his point is that even if you are not releasing them into community to their parents, at least evacuate the campus and
keep them somewhere
at a separate
whilst
place.
he still monitor the situation.
Yes, and Dr. Kunla, for example, is very much concerned. He has some very harsh words in terms of how they are. He thinks leadership when it comes to the health sector has collapsed. And that's how come we didn't see the kind of emergency responses that we needed to help deal with the situation as this. And he cites the example that we've dealt with Ebola. We've dealt with even more complicated scenarios, but we are struggling with this, and he's concerned.
All right, well, we can hear from him now.
There's no leadership. He could have on his own held press conferences every 5 to 6 hours to brief Ghanaians what actions are being taken to contain the situation. We are not seeing this. What do you want parents to do? To sit back home? No, they can't. They have to rush there to see what is happening to their wards. And this is dangerous for everybody. It is dangerous for everybody. It is not the headmaster who has to tell parents, don't come and take your kids. No, no, no. Why? It is not him. It is those who know or who should know that should tell parents what to do in situations like this.
So the authorities have failed?
They have failed miserably. It is a miserable failure on the part of healthcare leadership, led by the Honorable Minister. He has failed completely. And there's nothing that can exonerate him from this massive failure.
What would you have him do? The samples, the results of the samples and the testing are not out yet, so they don't know the cause. What would you have him do?
Why are the results not yet in?
These things take time. You're a scientist.
Why? Look, we have to understand. That is why you're making me repeat myself that there must be an emergency response to public health disasters of this nature. And so if you do not trigger those responses, your results will be delayed. Look, I've asked a question about 2 weeks ago, an urgent question, because we heard that there is a likely outbreak of cerebrospinal meningitis. 2 weeks ago, I filed a question. It hasn't been answered because I wanted to know the preparedness and whether we have vaccine in stock to reduce any impact of cerebrospinal meningitis. Up to now, the minister has not answered the question, and then this issue has come up.
What can be done to salvage the situation? The situation has already occurred. More people are dying, others are at the hospital.
What can be done now is to make sure that we have a clinic on site, that we quarantine the area, that we move most of the students to a side camp and fumigate the whole place. That is what we have to do. And that as we move in the students, we'll be able to segregate who is who, and what is his medical condition at that point of segregation. And then we reduce the numbers that may sleep in a tent, reduce it to 3, 2 or so. But make sure that you fumigate the place and then treat everybody, including those people who rushed in. They should be given the prophylactic, they should be given the antibiotic. Anybody who came in contact with the school should be treated.
Could this be due to...
You called for the people to be moved in order for the campus to be fumigated and everything. Yeah. The government's position is that the school will not even be closed down to allow for them to leave the campus. What's your position on that?
Well, I don't know. I know that fumigation kills virus or bacteria. You don't know. Listen, I don't know what is there. But I'm saying that at least we should take a step of fumigating the place and move the students a little bit out of that place. Fumigate the place before they can go back in.
Legitimate concern, of course, but he's not the only one who has concern. You've been speaking as well to the chairman of the Health Committee in Parliament.
Yes, Dr. Kwabena Chum Nyama. Well, he thinks that the situation could have been handled better. He's concerned that the first outbreak was back in March. It's not been contained up until now. And he thinks there's a problem with our public health system that urgently we need to pay attention to and help deal with.
Well, let's hear it from the horse's own mouth.
I think to the extent that, if you like, the whole health machinery of the state has been deployed to the Kumasi area to try and, if you like, unravel the myth behind these deaths in the school, we should be reassured a bit. But personally, I think that we should have done more than what we have done so far, to the extent that we had initial deaths in March, April, and we are now in December. Maybe we should have been more proactive in trying to get to the bottom of that issue. But
the system possibly failed all of us, you think?
I believe that with all the facilities that we have at our disposal, the fact that even with Ebola, we were able to map out a very good strategy to save the country and prevent us from getting the infection. We should have been more proactive with what we did. And I believe that the health apparatus in the country will do better. Because some of these things, once you take your eye off the ball, certain things can deteriorate. So we are only hoping that we say better late than never. The minister has assured us that the right steps are being taken. We've now brought in WHO to come and support the system to try and unravel the mystery behind some of these deaths. I expect that all the needed actions will be taken so that our young men and women in Kumasi and environs will be safe. We don't need to let this thing be on our neck. It will be a disgrace to the whole country that at this moment of our history, we will be suffering from something like this, and after all these months, we will still be caught napping and will not be able to find the solution as early as possible.
You're a health practitioner yourself. What could have gone wrong with the system to the extent that several months down the line, as you indicate, we've still not gotten to the bottom of this issue?
It really beats my mind, honestly, because I know how the system works. The surveillance system, it is well structured. So it's quite
disappointing,
isn't it? Unfortunately, we are where we are, but we will try and encourage them to do their best. Sometimes certain things happen which is beyond the control of even the practitioners there, and once the issue is still at hand, it is better you concentrate in finding solutions rather than looking at what has happened before. So we will all try and support them currently for them to do what is best to solve the problem for us. The minister has indicated they have given them some resources. We expect that more will be given as and when they are needed, so that we will not have any issues like lack of funds, lack of resources, lack of logistics in not being able to unravel this mystery.
Some have attributed it to it possibly being a spiritual happening and all, again, as a medical practitioner. So,
well, that one, it will be beyond my comprehension. So maybe we'll leave that to those who can see spiritual things, like the pastors and the imams and, you know, our traditionalists. We saw a lot of them in Kumasi during the funeral of the late Asante Hema. So maybe they can also do that bit. But for us, we are looking at the scientific and health aspect, and I believe that we all know the protocol that should be done when you get such conditions. So I believe that the state actors will do what is right.
So that's the chairman of the health committee in Parliament.
Yes.
And he obviously doesn't take the side of the health minister as they would usually, or as politicians would usually do.
Obviously, he was cautious with his criticism, but he still made his point.
Right.
Although you're expecting that as an NPP person himself, as chairman of the health committee, he would have been protective of government and how the health minister has handled it. But he was spot on that he felt there was a certain failure with the system from his perspective as a medical practitioner, which has to be dealt with. And that frankness, we probably need a lot more of that in Parliament.
But in the meantime, we need to solve the problem that's on our hand at the moment. More of the parliamentarians have been speaking, Gabo.
Yes, so even with the minister, they are expecting him back in 2 weeks to further update and pace. But Muntaka Mubarak, whose initial concern about this triggered the minister showing up because this is his constituency. We've been speaking to him as well. Well, he thinks that a lot of the responses he got are favorable to a certain extent, but he still thinks a lot more collaboration is needed between the health ministry and the education ministry to avoid all the chaos, in quotes, that is coming up following the situation there.
I've been the chair of the health committee. I've been on the health committee since I came to this. One of the things that I know about diseases is that if it is the type that moves from body to body contact, then it's dangerous, because then you'll be dispatching these children who may be carrying the disease but not in an active form home. So it's going to get active whilst you are home. That means you are going to now spread it to your household, which is more dangerous than when you keep the students in the same confinement. But the other leg too is that if the causal agent is within, say, dormitory or dining hall or the assembly hall, and you keep the students there, the tendency for more spread happens. So that's why we keep saying that the fastest thing to do is to get to know what it is. Because the moment you know what it is, then you know how it spreads, how you can contain it. So that is what we'll be doing. But I've been pleading with the parents who had come to take their children home. I may not be in a position to say that bring them and leave them in school, but bring them to take the broad spectrum antibiotics. Because what the broad spectrum antibiotic does is that it slows down the rate of infection, the damaging. It slows it down. So once it slows it down and they're starting to know what it is, then when they know what it is, then they can now give the right medication. But now if you've taken your child home, may God forbid, and the child is carrying some of the disease and it's going to mature while the person is home, that would be very dangerous, because then they don't even know where the child is. So if you bring the child back, they will know where your home address is and all the other diseases. So later when they get to know what is the true cause, and it is the type that can spread through body contact, then they will now be able to trace everybody. Because remember, even if you talk about evacuation in the school, they have about 127 teaching staff, and the non-teaching staff are also about 100. They are all residents and with their dependent. So even when you evacuate the students, the school still has staff, unless you are evacuating all the teachers and everybody. So I think that the bottom line is quick to know the cause. Then when you know the cause, all the other things becomes easy. Then me as the MP, the school authority, all of us who are so close are getting direct information. You panic. The simple reason why you panic is that you know that if they don't know the cause and you ask the children to go, there could be these consequences. If you keep them in school and the causal agent that is causing this disease is within the school, more students will be affected. So it's like you are torn. Which are you doing? But I think that with the broad spectrum antibiotics, which slows down whatever disease that it may be, it is better the children come to take the antibiotics and probably go home so that we'll all be monitoring. Maybe within the next few days, if they're able to know exactly what the program is, then we know, oh, you're staying home is not useful, so come back. Oh, you're staying home, or even the rest that are on campus should all move out for us to take ABCD action. So that's why it is difficult, and you are seeing this contradiction, because depending on what you say it is, it may not be necessary for them to evacuate the school. It may also be necessary for them to evacuate the school. So that's why the dice. But I think that the Minister of Education, Minister of Health should quickly put their heads together so that they'll be able to take a tentative decision. Because when you allow the Minister of Education, they don't have health background. All they think is that, can we evacuate the school so that it will be easy? Everybody is with his parent, so that even somebody is sick and is with his parent, maybe the parent can take the person to hospital faster. They will be looking at it. But if you are from the health background, you know that allowing the children to go, if the disease is the type that can spread through body contact, you'll be doing more harm by allowing them to go. So they should come together so that they will take a different decision, not to do this front and back and creating more panic in the minds of parents. Because the students, you know the way the school selection system is. Someone may be coming from Novrongo is there. Somebody is coming from Takoradi is there. Parents hearing this on radio, obviously, can you imagine the confusion that you are putting there? So the school authorities, together with the ministries, should be able to take a tentative decision that they think will be in the best interest of the children and the school.
So that Muntaka Mubarak there, the Aswasi MP, he posed the question that triggered the summoning of the health minister. He says he's going to the constituency tomorrow to gather further details and check up on the situation. So we look forward to hearing from him on that.
I personally look forward to hearing what more information the health ministry is willing to put out and what more steps they're taking to contain this situation, to make sure that it's not something that's going to spread to the entire town. Sure. But thank you so much, Gakpo, for that update. Joseph Opoku Gakpo, there is our parliamentary correspondent. He's been in Parliament bringing us up to speed. Now today, Simon Osei Mensah, who's the head of the regional security in the Ashanti region, spoke to my colleague Ohiming Teria.
A tripartite issue is an issue among the Minister of Education, Minister of Health, and then the Regional Coordinating Council. Health issue, and for that matter, that one must be dealt with by the Minister of Health. And then when it comes to the institution, it's an educational institution, and that brings in the Minister of Education. And we in the region, since the school is within the Ashanti region, it brings in the Regional Coordinating Council. So the three should work hand in hand and then make sure that we eradicate this epidemic once and for all. We informed you yesterday as per the briefing by the Regional Director, Ghana Health Services, within the region. They studied 3 areas. One was meningitis, which for now they've ruled out, that the studies or the tests have not proved that. Then they mentioned viral hemorrhagic fever or disease, which they say they've ruled that one also out. Now, what they've identified is bacteria, in relation to bacteria. And they made recommendations because we needed to identify the problem that we intend to solve. And we are solving 3 key problems. The first one is to make sure that we minimize or stop the spread of the epidemic among the students. The second one is to stop the epidemic spreading outside the school. And finally, to investigate and find a lasting solution to the problem. Now, they propose, together with the World Health Organization, they propose that we should give a 3-day dosage to all the students, the teachers and non-teaching staff, that whoever works within the confines of the school must take the dose. We started yesterday, and as most of you are aware, when we got there, most of the students had gone out because the parents had come for them. The day students were also not around, so we started the dosage with the few who were in school. Today they are continuing. Yesterday, by close of the, as we've been briefed, they had just about 200, but as at 10, they had over 1,000, which means that the students are returning to school to take the dose. We will monitor the situation up to Saturday. Then all of us will assemble a meet know the extent of the success or otherwise of the dose that they are giving to the students, and then the teachers and then the non-teaching staff. Having dealt with that, then we can come out with a final decision as to whether we are closing the school on day A or day B, and possibly for how long. Because the investigation is going to be long. It's not going to be so simple. They are going to look at all the dormitories and the classrooms. They will examine the kitchen, the dining hall. They will examine the water that they take in the school. They will scan the whole environment and even beyond the walls of the school. Because if you realize that the place is dumpy, we have all sorts of water bodies around the school, we may need to scan all those places to ensure that the bacteria is not coming from any of these sources. When they are done with that, then we are able to identify which atypical type of bacteria is causing those. Then we will decide to know when the students will be coming back to school. When the school is closed, initially it will be extremely difficult to give specific dates for which they can return. So far, all of us are on the same page. The Ministry of Education, Ministry of Health, Regional Coordinating Council, the Municipal Assembly, all of us are on the same page. As we've solicited since yesterday, we beg you, the media, let's be accurate in our reportage. You remember somebody even posted on the net, social media, that the regional minister said the cause is Ebola. And I don't know where the person got that from. Some people also were reporting that it's meningitis, when the medical officers have not said that. So let's report accurately. If you are in doubt, you call the regional director, Ghana Health Services, for the needed information. So from here, I will urge the the regional director of Ghana Health Services to give some numbers to you, so that if you are in doubt of any issue, call them, they will give you the information. If you are unable to read them, you can call the Ministry of Education, you can call the Regional Coordinating Council. Whatever information we have available with us, we will also let you have it. If we give false information, it leads to panic. It heightens the panic situation that we are having. So we beg you, let's give accurate information outside there. And in most of your reportage, let's solicit support of the parents and then the All Students Association, so that they will ensure that all the children return to take the dose. It's in their own interest to take the dose. For now, we are not too sure whether the epidemic is contagious, which can spread maybe through other means, maybe by air or something. We don't anticipate that, but we don't have to rule out other possibilities. We don't need to close the area of investigation. So if it's contagious, if infectious, and then you take the child to the house and the child has already been affected, definitely the child is going to spread it beyond the boundaries of the school, and that will be more difficult for us to manage. We want to contain this disease. We want to make sure that within the next maximum 3 weeks, we come to the end of this and have a full closure to this particular problem.
Regional Minister, let's hear from the health aspects. Now, the Ashanti Region Director of the Ghana Health Service, Dr. Emmanuel Tenkwang, has also been speaking.
Yes. For the meantime, we are addressing the issue of the students and then the staff. We are giving the dose to. Later, if there's a need, we'll have to consider that. But for the meantime, we have 19 on admission, 16 at the KNUST hospital, and then 3 at the Kofanoji Teaching Hospital. There has not been any reported death. The first is the 4 that we said. So 4 deaths, 19 on admission, but as the minister said, we have a total of 44 cases so far. All of them who are alive are responding to treatment. As I said, we started with antibiotics, and they are all responding to treatment. Because when you give the antibiotics, we realize that the temperature is settling and they are doing well. That's the same reason why we decided to give mass drug administration using broad-spectrum antibiotics to the students, so that those who are harboring the infection, we may cut the transmission immediately. So that's what we are doing right now in the school. This is the second day, and the students are cooperating. We would like to thank them for that, and then the parents. Then the next issue, as the regional minister said, we'll do the detailed investigations. The lab investigations are ongoing, yesterday night we sent some blood samples to Noguchi. We are also taking some to Kolebu, and we believe that all the results, when put together, we can lay our hands on a specific organism that is causing the problem, and from there we'll have a very clear way forward. So far that is what we are doing. But as I said, the most important thing is to bring your child for the treatment. So as the minister said, we are pleading that parents will bring their children to the school and have the dose. Once they are given the treatment, then we know that at least we have cut the transmission, and then the other processes will continue. But to get a uniform information, I wish that you rely on the health sector, more importantly the regional director, for your information, so that we may get the right facts to the people in this country. Everybody is interested, and for that reason we should have information from one source. So we will monitor the progress and give you an update as the issues unfold. Thank you.
Chief, what will be your reaction to people who think that the way the health directorate has managed this maybe not, it's not best? On radio and TV, people have been saying this. What will be your, how do you rate your efforts?
No, they are not technical people. They don't understand what we are doing. So maybe it's based on perception, and we won't begrudge them for that. We know what we are doing. We have been trained. I'm a trained public health physician who has worked for the period of about 27 years. So I know what I'm doing. So if it's a perception, I take it that it's a perception, and we won't begrudge them. But we will continue to do our best so that we save the life of Ghanaians.
All right, let's have a very quick discussion on this matter. Dr. George Amufa has a lot of experience in the management of public health issues such as this. He's worked with the Ghana Health Service. Now he's a private public health consultant. He's also vice president of the Ghana Public Health Association. Dr. George Amufa, thank you very much for your time here on The Pulse. Now, from where you sit and from all that you've heard, would you say that we're managing the situation the way we should at Kumasi Academy?
Yes, good afternoon, and thank you for the opportunity. A lot has actually happened, and following up, I think that there have been quite a number of things that have been done, which I would say are in the right direction. Because the steps in investigating any outbreak are clearly outlined, and I'm sure that those who are following it are also following that. Well, I mean, the first is to establish a clinical diagnosis, what will normally be that you suspect is based on the clinical signs and symptoms. I mean, some of them will be obvious, others may not be that obvious. But then you make sure that you manage those who are affected by the disease. I mean, in a proper hospital base. But before you are able to do that, you must confirm the suspicion, which is where the laboratory investigations come in. And they're taking samples to our national reference lab, the WHO recognized establishment, Noguchi. Some samples are told that be sent to the family special meningitis center, which has all the equipment and the reagents to do any confirmation. Others have been sent to KCCR in KNUSP, Kumasi. And so the process is definitely in line. What I'm not sure is whether they sent some of the samples outside the country. I mean, that normally is also part of it, especially if the initial diagnosis is make it down. They've run almost all the tests, and we are yet to get the final test. But so far, it looked as if quite a number of them were making it. But I'm told that by either today or tomorrow, Noguchi will come out with a final distance. Then there will be the epidemiological investigation. I mean, to find out who was affected, who were the contact for, where they came from, what is different from them, from those who are affected and those who are not affected. So that is currently ongoing. So that takes a little more time than the initial clinical investigation. But that is being done. They are being supported by a team from the WHO. And then finally will be the environmental scan, where you now want to look at the food sources, the water sources, the habitat, rodents, and all the things that can be associated with that. And so some of these things need a little patience, a little time, whilst at the same time keeping an eye on the management of the cases, so that you don't spread the infection. So that basically appears to be what they are doing. And I am okay with
you are okay with that. In terms of, there are people, we've just heard from persons and parliamentarians who are saying, or who are actually suggesting that they should have been evacuated and have the place fumigated. There's also an issue about controlling and monitoring students and parents' movement.
That is too hasty a conclusion to do. You see, in a situation when you are not too sure of the exact nature of the outbreak, you evacuate and then you spread the infection. I mean,
okay, so when they talk about evacuation, they're talking about moving them not necessarily to their houses, but finding a place where they can be kept and moving them there so that you can fumigate the school and bring them back.
We don't do that. I mean, that is really not the usual thing. There has to be a management center, like a reference center for Kumasi, where they have a business unit, a specialist, a place where they can manage them. What I didn't like to see was somebody carrying one of the patients. I mean, that's the part one. I think an ambulance to be nearby to do any sort of referral. But I mean, you don't put people together. But at that stage, you didn't want separate them one way or the other. I mean, because you don't want the mode of transition.
Isn't it as good as evacuating them and fumigating the place, since you don't know what exactly is causing the problem?
Fantastic. And so that will definitely be part of what should be done. I mean, the fumigation and other things. Because now they've started the treatment. Even for those who are not sick, they've started the vaccination. And so if there is now what you are calling the evacuation, then
it's good to do it now.
Come again?
Then if there's evacuation, then now that they've been vaccinated, then it's good to do it now.
I won't call it evacuation as such. I mean, you make sure that you feed all those who are in the school and all the contracts. I mean, and then in that case, in order to do the environmental scan, obviously you don't want people to be roaming about there. That one indicates the rationale for putting some of them back to where they came from. But normally that is specifically because of the environmental scan. I mean, to show that if there are any things related to the water, the soil, the food, and those type of things, you are able to identify them. And so it's not just a panic reaction that there's an outbreak, and so you get to evacuate anybody. So you are very, very careful in what to do in order not to spread further infection.
Well, very well. In such situations where we're talking about parents walking in and out of the school, reporters are going in and out of the school, there are other visitors, people who are curious, getting in and out of the school. What would you advise is done?
Yes, but out of now all spectators in school, including parents and guardians, I mean, stay away from the place. I mean, it's a sort of infection. You don't know what you are going to contract from there.
But it appears they're already there. They have been there. Some of them have been there to take away their children. Some have gone in and out.
Yes.
So what do we do with the current situation?
They treat some of their wounds and I've brought them back. When they had that they were giving them a treatment and vaccination and other things. But the health sector surveillance will be monitoring all the contacts, all the places, all the students, their homes, whoever has been around and other things, so that if there is any symptoms of anything related to fever, headache, and other things, they should be educated to report quite early, so that they don't spread any form of infection.
Okay. Doc, thank you so much for your time here on the Pulse. I've been speaking to George Amufa, Dr. George Amufa. He's the Vice President of the Ghana Public Health Association. He's actually satisfied. As someone who has dealt with such situations or similar situations in the past, he's quite at rest at what government has done so far. But if you are anywhere in Kumasi, thinking of going to Kumasi or around Kumasi Academy, and you're unsure what to do to stay safe, here's a little advice that we've sourced from the WHO for you. So we'll get through a bit of graphics here, some information here that can help you. How to stay safe. So there are many steps that you can actually take to help prevent infection from bacteria. Now you have to practice good hygiene, such as frequent hand washing. And you remember this is quite similar to what we had to do at the time that Ebola broke. Fortify your immune system with healthy foods such as fruits and vegetables, and avoid close contact with people who are sick with a contagious infection from bacteria. So you're basically not necessarily discriminating, but you're keeping yourself safe and away from anybody who has any sort of symptoms that suggest that they could have anything close to this bacteria. And also you only need to take antibiotics when needed to avoid developing resistance to antibiotics in the future, because then if you do have a resistance, then when you're given that antibiotics, it won't work. Okay, so certain viruses and bacteria are transmitted through close contact between people, like the point I made earlier. Several situations increase such as contacts, including the following: living or working with other people, sharing items, giving care to a person who's been infected, and frequenting public areas. These are things that you do that could expose you to any sort of bacterial infection. So you ought to stay safe. I mean, play it safe, really, even though we're yet to find out exactly what the problem is, what kind of disease we're dealing with here. You want to stay safe. Now, there are certain measures that you can take in order to prevent the transmission of viruses and bacteria. Okay, so those are the things that I've listed earlier on. But these are some of the measures as well that you could take. First, you have to get vaccinated, because vaccination is the best way to protect yourself and others. When a vaccine against an infection or disease is available, what you need to do is to get it. So for those parents and for anybody, including reporters, security personnel who have been to the Kumasi Academy campus, you want to get yourself vaccinated, or you want to get the treatments that the WHO is supporting government to give the students there as well. Now you have to apply recognized hygiene measures, like I indicated earlier. You keep your hands clean, you follow the tips and techniques for washing hands. You do that quite often with soap, of course, and you follow tips for coughing and sneezing without contamination. And I think that we know this already. You don't just cough out in the open, and you don't just sneeze out in the open. You've got to protect yourself and protect the other people who are close to you as well. Now, avoid touching your nose, your eyes, and your mouth. These are entry points for viruses and bacteria. Avoid contact with people who are sick or who are showing any kinds of symptoms, as they may be contagious, and do not get close to them. Do not touch objects that they have used, like their utensils, for instance. And of course, you have to clean your surroundings regularly. Not to say that, I mean, you should do that even if there's no outbreak, but clean your surroundings regularly, as well as the sanitary appliances you use. For example, you want to clean your counters and other surfaces that you touch often with your hands, and also wash toilets and sinks in order to keep them clean. Cleaning, of course, has proven to be a very effective way of killing viruses, which can survive on hard surfaces. And you clean with soap and water, or use domestic detergents. So like I'm saying, if you live in Kumasi, if you are around KUMACA, you're thinking of going to Kumasi, these are just a few tips from the WHO with which you can stay safe and stay away from the disease. We don't really know what it is, but the doctors and the health professionals are working around the clock to make sure that they get to the bottom of it. So stay calm. Do not panic. You're still watching The Pulse with me, Gifty, and up here. I'm going to take a very quick break, but when I come back, I'll tell you about ECG and how some customers have had to queue up, agitate, get angry just so they could get power to their house. What happened? Has the problem been solved? I'll tell you all that when I return in just a few minutes. Please stay.
Issue.